I noticed a reduced vision when I was about 14, when I was in 8th grade. And I went to my local optometrist, and he completely misdiagnosed me for 5 years until late into my senior year of high school. I went to an ophthalmologist. He said I had keratoconus. It was extremely severe, and the only options I had were wearing a really hard contact lens, which I hated. That year I went on a gap year prior to school wearing my contact lens, and I couldn't wear it any longer. So halfway through my gap year I came back home. I saw another eye doctor, and they said the only option was cross-linking. I got the eye cross-linked. It was like the most pain I'd ever been in my life. And they said if the cross-linking didn't work, then I would need a corneal transplant. And I'm 20, and those often fail, they reject, so I knew the statistics on that, and I knew that I needed to fix my eye. So I'm living in Madrid. I was a nanny for a young family, and I had a fair amount of time. I watched a bunch of YouTube trying to figure out how to fix my eye, and I found Dr.Gulani. And doing that, I just felt like there was hope. And I come here, I called him doing the virtual call when I was in London, and that was a year and a half ago. And now I'm here, and I got here, my cornea is at 380 microns, which is extremely low. No doctor would touch anything under 450. And he came here, he said, we think we can put in Intacs, which would help strengthen and even sometimes help restructure the cornea, which blew my mind because no doctor in the world would ever think of doing that. I did that yesterday. I saw 2500 prior to the surgery, and now I see 2040. The surgery is only to prevent it from getting worse. It wasn't even to give me better vision, and now I have almost perfect vision.
What Dr. Gulani gave him beyond the vision is even greater, because the depression that ensued from
Yeah,
that
that was really
is hard. And now he'll be happy.
Yes. Yes.
Amen.
Yes. Yes.
My name is Luke Baxley. I'm 25 years old. About 3 years ago, when I was driving, I noticed I really couldn't see street signs all that well, whether it was far or up close. So I would tend to kind of miss my exit if I was driving somewhere I wasn't familiar with. And so I went to 3 different eye doctors. They all told me the same thing. It's keratoconus. I only had 2 options, and one option, 90% of the people when they do it, they don't even wear it, which is the hard contact lens. So I didn't want to consider that. They told me glasses could fix it, could not, and I just figured that's a waste of money. So after hearing that from the 3rd doctor, I just kind of got down about that because I didn't want to settle for that. But at the end of the day, they should know what they're talking about. And so I started looking up surgeries and treatments, and a YouTube video came up for Dr. Gulani. So I started watching video after video. I stayed up till about 4 a.m. just watching and learning and taking notes on the videos of what he's talking about and what procedure he uses for it. And very next day I called, and I didn't think I was going to be able to get in for the next couple months or so, and they told me, oh, you can come next week. So the fact that I heard that kind of gave me hope that I could get it fixed. So when I came, the one thing Dr. Gulani said is that I'm not accepting that answer that the other eye doctors gave you. So right there, that just put more hope in me. He said, we're gonna fix it. So we ended up doing the laserplasty and cross-linking in the same day. I had no pain in my eye. It was just maybe some slight discomfort just from everything that happened in one day. But overall, like, my vision just got way better. Just within one day, I was able to actually read letters with my left eye alone, which I've never been able to do within the past 3 years.
Okay, so I'm gonna try to keep this as PG as I can. I'm sure you all feel the same way. So bear with me. My name is Gulani. I go by Rue. I'm from Nashville, Tennessee. I got diagnosed with keratoconus probably about 20 years ago. Dealing with the cornea specialist for many years that told me basically the same thing everyone's been told. There's nothing that can be done. I was fitted with RGP lenses. I wore those up until about 2 years ago. The clear lens, I will admit, it did help quite a bit in comparison to the RGP lenses. From my understanding, what I was told, the RGPs caused some scarring down the central part of my cornea, which, as you know, some of you, it makes your vision a lot worse. Just doing my research on doctors because you just, want the best vision possible. So I actually discovered Dr. Gulani back in 2014, and the reason why I put coming to see him, because like all of us, I'm sure, was kind of skeptical, and it was just, mind-blowing, some of the stories I started to listen to over the years. So I was, not necessarily scared or anything like that. It was more so, we've all been told nothing can be done repeatedly, and it's just mind-blowing how these doctors, they don't really go the extra step like this gentleman has done. And it's frustrating at the same time because from my understanding, correct me if I'm wrong, doctors are supposed to take some type of oath to provide the best outcome for patients. So it's very frustrating to have to wait 20 years when I could have had something done years ago that could have helped me earlier than later. And so now, as of yesterday, I had a cornea-based surgery where it was structural. And so I was told, from this institution, which has been great, no complaints whatsoever, no pain whatsoever, that it's just going to be a process for myself because I've gone so long without good vision. So far I'm happy with how it's turning out, and I'm just trying to be patient so I can see my vision improve. So thumbs up to Dr. Gulani.
My name is Hadis. I'm coming from Texas. September last year, I diagnosed with the keratoconus. Back then, I was really good shape. I could see at night. I could read on my laptop or read a paper. The doctor suggested me to wear the RGP contact lenses. I tried them for like 7-8 months, but none of them were fitted on my eye. Then I was seeing that my vision was getting worse. I asked for an appointment. First, they rejected me because they were saying that keratoconus is progressing slowly. I insisted for an appointment. Then when they saw me, they got shocked. And then they did a surgery on my good eye on cross-linking. But for the left eye, which was the worst eye, they didn't have any answer. They were saying that wait till you get older, till 60, then we can do a transplant. Yeah. Then I was trying to search online to fix my eye. Then I found Dr. Gulani. First I was skeptical because the doctor was saying that nothing can be done in your eye. I was seeing all the testimonials online, and they were getting a really good result. And now here I am. I did my intacs plus cross-linking surgery. I didn't have pain. It was way better than when I did on my right eye.
Amen.
My name is Ida, and I come from the Sarasota-Bradenton area to see Dr. Gulani because I had a botched cataract surgery, to say the least, in that area, very well respected practice. And their solution was going to be no solution. They wanted to take out these Vivity lens, which multifocal, and put in basic Medicare lens, and then just wear glasses was their solution. And so I could not see well. My daughter found Dr. Gulani online, and it was the best thing that could have ever happened. I had
Praise the Lord.
laser plastic yesterday. Absolutely no IVs, and no oxygen, and no pain. And everything is better already, and I am just so grateful. And the enthusiasm that Dr. Gulani has when he's determining what solution he's going to use so that we can have the best site ever is just, you can just see the optimism. And coming in here when I have an appointment is such a pleasure, because I'm going to see Dr. Gulani and his wonderful staff, who is just as caring and makes you feel so good, unlike many other places that, was, so it's just totally different, and I feel so blessed to be here and go through this. And for everybody else, I hear some of these stories, and then that's why he does it, and it's like, even more so how grateful I think we are to be here.
My name's Torres Ingram. Born and raised in Nassau, Bahamas. So my mother, she and my family flew in from the Bahamas for this week. But I reside in Las Vegas, Nevada with my girlfriend, Dee. In May of last year, I had a smile procedure done, laser eye surgery done in California, where me and my girlfriend originally resided before we moved to Vegas. And the first 3 months were great until I started having very severe dry eye, like really cloudy vision in my right eye, and I go back to my eye surgeon from my surgery to do a follow-up, and they said, oh, I developed keratoconus. And they said it was like 1 in 2,000 people that develop it from the Lasik surgery, whatever the case may be. So I then moved to Las Vegas about a month after that, and I saw some cornea specialists in Las Vegas in the Nevada area, and they told me that, of course, the hard contact lens, or again, wait till I'm 60 to have a cornea transplant. I was 23 at the time, just turned 24 in March of this year. But in December of 2022, after I spoke with the people in Nevada and the people in California, I told my girlfriend that I'm not taking no for an answer. So I started YouTube, and I just typed in how to fix keratoconus. Whatever I find is how I do it. And I kept seeing videos of Dr. Gulani. So I WhatsApped my mom, and I said, because she was trying to find, doctors or people she knew in the Bahamas that had doctors in America to go to. And I said, Mom, all due respect, I'm not listening to any of them. This is the doctor I'm going to. And she wasn't with it originally, because she was kind of skeptical, because it's not what anybody in the Bahamas has talked about. So I said, just watch this video and let me know what you think. And she called me back and said she had peace in her spirit the first video she saw from him, and she said, we'll go with Dr. Gulani. So I had my first teleconference in January, and I was actually here in February of this year. And I don't know how many of you may have had this happen to you all, but Dr. Gulani actually sent me back. And he didn't operate on me in February because I was not stable, and I was still changing in my vision and in my cornea for him to operate. And that was something that struck a nerve in not only myself but my family, because if this was really about money or anything of that nature, he would have just operated regardless. He wanted to make sure I was in perfect condition for him to give me the best outcome. So I came back this past week, and I operated yesterday with the laser plastique. Of course, certain measurements changed because I was stable now. And because I'm not a virgin eye, because of my previous surgery, my 2020 was 2050. I did my post-op in the room before we did this. I saw 2030.
We just want to give God thanks for Dr. Gulani, because we know that it's not Dr. Gulani himself. It is God using him as a vessel to heal all of us. And we just give thanks and praise to God for Dr. Gulani.
Yeah.
I think we all feel that.
Yes.
Definitely. He's God sent, he's covered. This whole entire office is covered, so like honestly, and I don't think he said that, he was wrongfully diagnosed as keratoconus. So they wrongfully diagnosed him as keratoconus, and they caused that for him. He had Lasik fatigue from that Lasik surgery. He never had keratoconus. It's not in his genetics. It's not from his family. So the only reason he had to deal with this is from going to get that Lasik surgery in May last year. So he has been able to, and I feel you so much about the depression, because as him being a young man, he went through a very hard time as a depression, and not only me, but all his family felt it. So this is really so much of a relief for all of us. So thank you so much, Dr. Gulani.
My name is Dylan Ryan. I'm from Newfoundland, Canada. Even as a little kid, I probably knew at the age of like 5 or 6 years old, I've had glasses until the age of 18. From which then at the age of 18, I had laser eye surgery, which lasted like 7 or 8 years. Since I was 20 years old, I moved from Newfoundland over to Edmonton in Alberta. Right after, it was like 2 years ago, I had to do a retina surgery, which they found holes all over the retina. After which they said that there was another surgery that I done for cross-linking and everything else. At the end of the day, they said that it was keratoconus, which our actual liability come back to the eye doctor in Newfoundland. We've done our job that he cut the thin or the layer of my eye too thin, so it started to go and bulge. At the end of the day, I went ahead and the keratoconus thing that they said, I went on YouTube and I was trying to relate to all of everybody here, saying, okay, well, living life with keratoconus, what's the best action? Did they give me the scleral lenses? And I've had an uphill battle with that every day. Every day was getting harder and harder. But just living life, when I typed in that video, living life with the keratoconus, there was one video there that related me to Dr. Gulani. And I'm gonna tell you, since then I got so emotional. I was like just thinking in the world of the eyes. Like, I mean, I've seen probably a dozen eye doctors last year, and everybody said there's no cure. And seeing that video, my opinion on that man, he's a god in the world of the eyes. He's a god before men. Everybody else is not able to do the work that he's able to do. 100% respect. I can't even talk anymore. You've done such a good job, Dr. Gulani. Thank you so much.
Hi everyone, my name is Stephanie Turan. I'm actually sort of local from Orlando, Florida. My story begins at age 25 when just a random day I'm watching TV and I just started to see kind of the subtitle letters were kind of bouncing around for me. I thought that was really odd. I started to feel sick. I got blood work. I went to see my PCP, and unfortunately, I was diagnosed with a brain tumor. So luckily for me, it was benign, and everyone was telling me that the vision problems I was having was because of this tumor. So when I got an MRI done, I went to see the neuro. He told me, hey Steph, the tumor is not in any way close to the optic nerves. So whatever you're experiencing has nothing to do with this. I did my research. I found the best ophthalmologist in my area. I was in there for about 4 hours. They kept me there and I felt really discouraged because I said everybody kept going out of the office. I was just the only one there till I was the last one. After 4 hours, the doctor comes back and tells me, so unfortunately, I'm sorry to tell you, but you have keratoconus. And I'm looking at him like, okay, cool, what's that? Like, I have no idea. He starts to explain what the disease is, pats me on the shoulder and says, I'm so sorry, there's just no cure, and sends me home. That car ride for me and my mom was probably one of the most devastating moments in my life because I knew what was coming. But something inside of me told me that there was hope, that I had to keep looking, that I had to do research. So maybe a couple months later, I went to see my family optometrist. And he said, no, I mean, there's no cure, but there's options. So he put me on scleral lenses. All right, I did that for about a year. It was hard, it was painful. However, it did give me vision. So I was kind of content. About a year later, I started to see decrease in my eye, like my eye health and just in general, not just vision. When I went to research another ophthalmologist, he saw me and he was like, in good faith, I couldn't touch your eyes in the condition they are right now. You need to immediately get off the scleral lenses. And he put me on a 3-month treatment with omegas, steroids, just to kind of heal the eyes. The eyelids were falling apart. Like they were like looping off. I don't know how to explain it. At that point, I was just kind of losing hope. And until I just kept doing research online, and I found 2 doctors that could allegedly treat me, right? I thank God for guidance and for intuition, and I ended up going to Dr. Gulani, just because the other doctor was very generic and did one step for everyone. And I saw that Dr. Gulani does individual work with everybody's individual treatment or whatever they have. So yesterday was my surgery. Everything came out perfect. And I'm just very grateful for him. And not only him, like some of you said, his staff. I felt so welcomed. I was so tired of going to doctors. And, you know, most of us keep our depression inside. We try to stay strong. But there was a lot of staffs that kept telling me, like, oh, I'm sorry, your eyes they're just done. I'm sorry. Like, no empathy whatsoever for the patients. And here was nothing like that. I really felt at home. Everyone treated me so good.
Yes.
So I really want to say thank you to the doctor and to all his staff for helping me out.
Well, my name is Anna, and I'm really years old. And when Dr. Gulani said, "You're too young for this," I rarely hear that anymore. So I was like, okay, tell me more. My story starts, a few weeks ago. I knew my vision was going. I went to the eye doctor, and Tech does all those machines, and I looked in here, and he took a picture, and it was all pretty, and you could see the veins. And over here, all of a sudden the Tech thought she wasn't doing it right. So she called me back in to do another one. There was nothing on the screen. And so she had me go in to see the doctor, and the doctor referred me to Dr. Gulani. I'd never heard of him before. I live right here in Jacksonville. And he goes, "I'm only gonna send you to who I would go to." And so I'm here within 2 weeks, and he squeezed me in because I'm going to visit my daughter in Orlando. But what I had was what he called a trauma cataract, where this eye was doing all the heavy lifting. I mean, my vision was going because I was seeing through both eyes. This one was doing all of the work, and this one, no light was penetrating, and I didn't even know that. I knew it was blurry, but what had happened and what could have been, although nobody's saying for sure, is I was in Lowe's 2 summers ago, and I fell backwards. Ambulance came and got me. I was in a coma for 3 days, and I was in the hospital for a week. But they never once checked my eyes that I can remember. But over time, my vision started to go, and I knew it was this eye. But anyway, I was too young for this. And so Dr. Gulani took me in, and he called it a rock. He's like, you have a few things that are, catches. One of them is this thing is really thick. He called it a rock. And then I had the previous, just for to be able to see a little better without glasses, I had Lasik. He said those 2 things has him a little, And so I thought walking in here, I had the worst of it. Now I know, no. And I guess because of the hardness of the cataract, I'm still, up and down. Sometimes I can see 20/20, sometimes, I can't. So anyway, that's my story.
Well, my name is Kim Carpenter. It's my husband Ken, and we're from Southern Ohio. My story goes back to where I'm 65 years old. I'm proud of it. And I started wearing glasses when I was about 20, and went to the eye doctor every year. Was always under the correction of glasses. Could see fine, never had any issues. The last few years, I thought my eye doctor just wasn't getting my prescription really fine-tuned, and I complained about it. I even switched eye doctors. And last January of 2022, I was prescribed glasses, and the doctor said, "You have the beginnings of cataracts, but it's going to be several years before those have to be removed." And so, fine. So I got my new glasses, and I went for about 5 months, and I just started my vision was declining, and I blamed it on everything. Then I ended up going back to the eye doctor, and I said, there's just something not right. So I saw another eye doctor in the same practice, and she said, oh, it's this cataracts giving you this problem. I said, cataracts? They said I had the beginnings of them less than 6 months ago. So she says, well, you need to be seen by a local ophthalmologist. And so I did. I went, and he did all this tests. We had talked about the lens implants and do I upgrade and blah, blah, blah. Well, he came back in and he started scratching his head and he said, I'm just gonna put in the standard lens. And I said, well, what changed? And he said, well, I'm seeing something in your numbers. They're all over the place. I had no idea what that meant. And the next thing I know, he says, I don't know much about it, but I'm suspicious that you have an underlying eye disease called keratoconus. And I said, please write that down. I have no idea what you're talking about. And he said, but I would like for you to see a cornea specialist in Columbus, Ohio. So I immediately said, well, let's get it scheduled, let's go. He said, no, I think we should do the cataract surgery first. These are two entirely different problems, and I'm the cataract specialist, he said, and I will remove the cataracts, then send you to the cornea specialist. Should never have went that route, but can't rewind. So I followed his orders, had the first eye done, went in for my checkup the next day and found that everything on the eye chart, I seen double, like a sheep being led to slaughter. I went in and did the second eye because he said it's healing, it'll get better. So had it done, come back, same thing with the second eye. And I'm sitting in that chair and I'm just about ready to have a meltdown. You know, doctor, I've lost 50% of my clarity of vision, 50%. And I said, I don't know anyone in the whole world that's had cataract surgery that doesn't just rant and rave about how wonderful they can see. What has happened to me? What's went wrong? Nothing's been wrong. I'll send you down to get a new pair of glasses. And I'm like, glasses? What about the cornea specialist? I thought he would call his friend, the cornea specialist, get me in, you know, I've got a patient in my office, I need you to see her immediately. He turns me over to the receptionist, she calls, it's 5 weeks before I can get an appointment. 2 days later, I'm back down to see my obstetrician, and she says, Kim, I don't know anything about this disease other than basic stuff. You need to just wait it out. I was so disappointed after talking to her, the cornea specialist. She sent me to contact specialists within her office, and she said, sclera lenses, they're a life changer. 2 weeks, I went back, I saw him, and that started the process. I had never worn contacts in my life, so this was all new. He put me in sclera lenses. I got the fogginess after about half an hour of wearing them, and it went from bad to worse. It cut the oxygen off of my corneas, and the last ditch effort was wear the sclera or wear the RGPs, but wear soft contacts under them.
Like a piggyback.
A piggyback. That, he said, if this don't work, I don't know what. There's nothing. So I went that route, but then I couldn't see anything up close. I can see distance, like driving with those in, everything was nice and clear, but I couldn't tell how fast I was going because I couldn't see the dash. Because in January, to just throw in the towel and say, well, this is as good as it gets because I've done everything that I was told to do. So I, like everybody else, started stalking Dr. Gulani. I just typed in keratoconus fixes. Dr. Gulani is from God. He opened the door. I hesitated to go in because I don't want to get, scammed and stuff in this day and age. So much has happened in between, but I had the surgery yesterday, the laser plastique, and it's just amazing. I'm anxious to get back down here in a few months, get the left eye done, so I'll be balanced. So I'm just grateful, and I hear all your stories, and I give thanks to God, and I'll keep every one of you in my prayers.
Thank you.
I'm Allison Sanderson, and I was diagnosed with keratoconus 24 years ago. Needless to say, the same thing. I went in and they told me that, so you have keratoconus, and he said, I'm just going to tell you right now, he said, there's nothing you can do about it. He said, every year that progresses, you're going to have worse and worse vision. And I just looked at him and he said, so there's no surgery, there's nothing you can do, you just have to deal with it. So and when he put me in my contacts, obviously you see, and they're hard contacts, and they're very hard and they're painful. But yes, I could see a lot better, but it's still, I think for the last 24 years silently, I've suffered with so much. My eyes were so sensitive to everything that literally even getting one thing in my eye, I suffered from more styes and more swelling of my eye that I just kept telling myself, it's fine, you deal with it, and I prayed every day. I kept saying there has to be something you could do. Honestly, and I went to doctor after doctor, and the funny thing is they never told me that I had any kind of there was nothing to help me, right? I went to my sister-in-law called me one day and she said, I don't know anything about this guy, but I was just going to send him to you. I don't know if you've ever done anything with your eyes, but her brother did PRK, and she said it was very painful. And she said he didn't get the vision that he thought he would. So I knew there was a reason I didn't go to that guy, and I never pursued him at all. I went to his website, and with him looking at his website for a few minutes, I started crying. And I was just reading some of his stories, and I was I gotta go see him. The first day, he got me right in, and I got in the car and I told my husband after meeting him, I was his demeanor, the way he talked to you, the way he made you feel, he didn't praise himself or he didn't say anything glorifying of himself. I would say, here, you're the miracle worker, and he'd be like, no. It was all about, it's not about him. And even a comment that he made to me that really, he's looked at me and he was like, look at me, he's like, I'll treat you like I'd treat my sister. And it just made me really think to myself, I've never heard a doctor ever talk the way he did, had the compassion, what he did. I told my husband in the car, I was like, he's the guy. I was like, I've never felt more this was the guy I knew was the guy to use. And we went through all of our appointments and everything, and I had surgery yesterday, and I went from having which no doctor told me I had any of these except for keratoconus. When he diagnosed me, he said I had lazy eyes, I had keratoconus, I had astigmatism, and I already had cataracts. So I had 4 things going on in my eyes, and I knew, he looked at me, and it was funny because the last couple of years I've noticed my eyes really getting bad, and I couldn't even drive at nighttime. And he said to me, we didn't say one word to him, and he just looked at me and he said, your eyes have gotten worse in the last couple of years, haven't they? And my husband looked at him, we were like, how'd you know that? He was like, I can just tell. But I had the surgery yesterday, and I can see even better than he can see right now. Oh, wow. I woke up this morning, I sat there drinking my coffee, and I've never seen anything on the screen before. I could read all the words. I know I shouldn't have been looking at TV, but just think how
I cheated.
My mom had some whatever, and it said Christian whatever, and I read it, and I looked at my husband, he looked at me, I started crying. He's like, can you see that? And I was like, it's clear. And I put my hand over this side, nothing. This side he did. And I know that every day it's going to get better. And even if it stayed what it did right now, I feel like I got a huge miracle. Yes. And every day I say this, I waited 24 years, but it was worth every 24 years to get him. Yes. Wow. So thank you, Dr. Gulani.
Hello, I'm Joshua. I'm a local from St. Augustine. my story is not as impactful as everyone else's, but I'm glad to hear from all of you on this. But for me personally, it's just, I've had glasses for many years and I kind of just didn't really enjoy having them. And so it was eventually looking into just like, what can I do to like fix my vision to not need them? So I talked to her and she found out from her boss that like Dr. Gulani was like the best vision person in Jacksonville. I was like, well, I'm a local, this is great. And so I came in, I think, was it last week? And they're like, we can set you up this week. And it's like, that's really fast. I was not expecting that from like a doctor's appointment. Like, let's go for it. And I had to put our surgery yesterday and my vision is much clearer. So very thankful for all those.
Okay, well, my name is Mitchell. I'm from Pennsylvania, but I go to college down in Daytona Beach at Embry-Riddle. I've worn glasses since, I believe, like 3rd grade elementary school. I've just had poor vision ever since. I hated glasses, so eventually I switched to contacts around middle school. And my vision was pretty stable, but it was obviously, if I didn't have contacts in, I could barely see a few feet in front of me. It was like terrible. Waking up, it was like, I just want to go back to bed. Like, I can't see anything. And I kept moving on through high school just with contacts and everything was fine. And I started looking at, I'm planning to try and become a pilot in the military upon graduation. And their requirements are perfect vision, 20/20 uncorrected. So I could not have contacts or glasses to become a pilot. So I started looking at Lasik as an option because they accept Lasik and PRK. And that's where I found Dr. Gulani because he's only an hour drive away from Daytona Beach. I came up for a consultation and he discovered that even more than what I thought I had. He discovered I had a astigmatism that was like, my cornea is like saddle shaped. So no doctor had ever caught that in the past. I asked him if he could fix it and he was like, well, we'll give it a shot. And yesterday I had the surgery and prior to yesterday I would never be able to even make out what's written on this water bottle this close to me. And now just in there I could see 20/15 distance vision corrected and 20/20 close up. And I'm guessing that's only going to get better. So Dr. Gulani is welcome on my aircraft anytime.
So I was born with keratoconus, so I've always had to wear glasses, hate glasses, but you need to see. Just like everyone else, every doctor I went to can't really do anything. The most optimistic answer I've ever gotten was when I hit around 30, which almost there, I would have to get the cornea transplant, which didn't really want to do, but I'm kind of go with the flow guy, so I'm like, all right, well, if that's what it is, that's what it is. My mom, she never does that. She's always looking, so she found, moms. She found Dr. Gulani, and came here. This is my 2nd surgery. First one I did was for the structure where they put the ring in the eye. This one was the cross-linking. Being kind of sensitive right now, but I've had a great improvement. So yeah, really thank God for Dr. Gulani. Love the staff. I hate going to the doctors, but this is a doctor I'll come to. Yeah, everything is good. Hopefully. Yeah, did the left eye. In the future will be the right, and looking forward to not having to wear glasses ever again. So.
I don't need any accolades. You are my blessing, all of you. Keep it up. Safe in your flights, please. Careful, eyes closed. Use your medication drop. This is just day 1, right? Love you all.
Love you too. Thank
Fly back to London.
Safe travels, everybody.
It was lovely to meet you. Best of luck and success in your future. Yes, wonderful to meet you.
Anna. Mom, how are you? Miss Bahamas? Yeah. Thank you. Big guy. Ken, be nice to her.
Thank you. If I did, she'd just say it.
My pleasure. Please. Thank you very much. Sure, absolutely. Please come like this. Good to see you. Look, big guy.
Thank you.
Safe travels back. Big guy.
Thank you so much.
Be amazing. Remember, okay? I'll see you up front.
Thank you.
Mr. Pilot.
Yes.
Good to see you. Come. Hi. Good to see you. Definitely. Come on. This way.
Thank you.
Pleasure. Absolute pleasure.
You've been an answer to our prayers. To our prayers. Yeah.
Come on, Tess. You too, please. Come this way.
Thank you.
Come. Again, I feel indebted to all the travel from so far, far away. I know it's expensive, it's difficult, you're away from work, from family, but it becomes my personal responsibility to see you all. It's an honor. I thank you all for allowing me to execute my passion. Thank you.